I have three hats on. I'm the Director of the National Education Psychological Service. I'm on the NCSE Council. I'm on the NCSE Council Committee. And with all those hats, I am really proud to be presenting what I consider a practical and a highly research-based combination of presentations here. So what we're talking about is people who have got expertise and who are in the schools and who are researching and who are doing it in the Irish context. And I think you're going to get a really valuable input here. So what we have, we're starting with, I'll introduce each person as we go along. We have Richard Ruttledge, Dr. Richard Ruttledge, who's a psychologist in Cavan for the NEPs, and he's going to introduce the project that NEPs were involved in, the research we did on the Friends project. I had a lot to say about it, but I'm not going to say it now because Richard will introduce it and we're short on time. I just want to point out that Richard is representing a group of people in NEPs 5 of whom we got trained as trainers and friends, and Gabrielle Green is convener, and you'll see that on the first slide. So the first presentation is from Dr. Richard Ruttledge.
Good afternoon, everyone. Hope you enjoyed your lunch and that you're not feeling too rushed like I am. Just on a point of order there, Maureen, my office is based in Cavan, but I'm from Monaghan. Very, very important to clarify that, just on local rivalries. So I'm Richard. I'm an educational child psychologist with the National Education Psychological Service. I'm delighted to be here, but I am here representing a wider research team. Namely, they are Eileen Devitt from Kerry, Gabrielle Green, Regional Director in Limerick, Mary Mullaney in Navan, Elizabeth Charles Kilkenny, Joanne Frehel in Dublin, and then we had two research assistants, Maura Moriarty and Afric McCardle in the Ennis office. So again, I'm the face of this to you, but there's a wider group of people who are just as involved in this as me. So I want to talk to you a little bit about, again, a programme called Friends for Life. I'm hoping that some of you, most of you will have maybe heard of it somewhere along the line. Maybe you haven't heard anything, and it's great to be here to talk to a wide, diverse group of professionals in education, but also parents as well, because it's very important that you hear this information too. So anxiety, there are a couple of main themes that I want to outline before I go into the actual nuts and bolts of the study. So anxiety in children and young people, and I know in my practice as a psychologist in schools, I'm seeing this more and more. And the prevalence levels, are range in variance in terms of, how often this happens. So some would say 21% of the population, other studies say in around 10%. So it can vary, but it's quite a significant number if you think about it. It can have negative consequences on educational attainment and social functioning. So there's a clear link between having anxiety and it affecting your actual functioning in school, but also in wider society. And again, if children do have I suppose elevated levels of anxiety, it can influence whether they actually develop mental health issues later on into adulthood. Another concept that's important to backbone our study is the whole area of resilience in children and young people, and that's a term that's bandied around quite frequently now. But really what we mean by that, it's the capacity of a person to prevent, minimise or overcome the damaging effects of adversity. And again, there's some characteristics associated with being a resilient person, and they include using effective coping strategies to deal with stress, effectively controlling our negative feelings, having a sense of self-efficacy or mastery in our lives, and also accessing the available social supports available to us maybe in our families, in our schools and in the wider community. And finally, another concept that's really important to our study is the whole sense of belonging in school. I really personally believe that having a sense of belonging in school is so important. It sounds very warm and fuzzy, but it really does make such a difference. And again, there is research here to back this up, that said, that not belonging can lead to disaffection and disengagement from learning, and it can also lead to feelings of anxiety and depression. And again, schools where pupils report more feelings of connectedness to adults and peers were strongly associated with higher pupil ratings of resilience. So early intervention, again, a term that's mentioned very, very frequently, but what do we actually mean by that in the whole area of anxiety? Interventions using cognitive behavioural approaches, and cognitive behavioural approaches are the intervention that's recommended specifically for anxiety because they teach children and adults around making the links between our thoughts, our feelings and our behaviour, and that's the backbone of what the Friends for Life programme is really all about. Again, frequently childhood anxiety is overlooked. These children are often shy, cooperative and compliant. They will come in and out of school every day quite quietly, not really cause much trouble, and they can get missed. In a busy school environment, and they can be missed. And again, I know in my caseload as a psychologist, oftentimes it's the more externalizing behavioural issues that get, brought to my attention, whereas, these children who are quite quiet, shy and compliant maybe don't get raised as often as well. And again, in a lot of instances, a lot of girls, because my caseload is predominantly boys, and I think there definitely is girls out there maybe that I'm missing. So again, children from disadvantaged communities are less likely to receive interventions, and they're more likely to disappear from services. So they will maybe start off attending clinical services, but they can maybe just drop out of the system and then they get discharged. And again, we need to consider how we can apply evidence-based practice in the schools, to try and make these kind of interventions as accessible as possible to children and adolescents. So it's not just a small number actually receiving them. And we also have a strong economic argument here. There's a Nobel laureate economist, Dr. James Heckman, and he posited that early intervention for children and young people is optimum, as later intervention in adults is economically inefficient. So again, we're all saying this, but there is an actual research base in economics and in psychology to say that early intervention is really important, and we need to start thinking about how we might actually do it, as opposed to just maybe talking about it. So the role of schools, and again, not to overburden all of the education professionals here, schools are often mentioned as the solution to all of society's ills, but you really are very important in that. And there's growing recognition, across a range of areas. A meta-analysis, and that's an analysis of a lot of studies by Durlach in 2011, found that school-based universal social, so what I mean by universal is that it's whole class, it's delivered to everybody. Social emotional learning programs significantly improve social functioning, behaviour and academic performance. And I want to really emphasise that link, that social emotional learning programs have been shown to have a positive impact on the academics, so that attainments actually increase. And I'll talk a little bit more about that later on. Again, there's overarching policy documents. The Vision for Change, published in 2006, recommends this kind of work. The Reach Out National Suicide Prevention Strategy, and also the more recent Better Outcomes, Better Futures from the Department of Children and Youth Affairs. So there's a wide range of policy documents across departments and in government there telling us that this is the kind of work that we need to be prioritising and doing. In addition, the SPHE curriculum provides opportunities for children to improve their ability to cope with problems and emotions and to develop their interpersonal skills. And anything that I'm talking about here today around Friends for Life is firmly rooted in the SPHE curriculum as laid down by the Department of Education and Skills. There's nothing in this that is outside the boundaries of that core curriculum. So the Friends programmes, what are they? They're developed for children aged 4 years right through to adulthood. Each programme is similar in theoretical principles. The Fun Friends, as you can see, is for children aged 4 to 7. The Friends for Life is from children aged 8 to 11, and that's the programme I will be talking about specifically. The My Friends Youth programme is for children aged 12 to 16, and the Adult Resilience programme is for individuals from 16 years all the way through to 100. So Friends for Life. So why did we pick Friends for Life as psychologists in NEPS? We chose Friends for Life because there are other programmes who would claim to do similar things, but we opted for Friends for Life because it's been developed and licensed by Pathways in Australia. It is an Australian programme based on cognitive behavioural theory and early intervention for childhood anxiety. And again, it can be delivered universally. That was something that was really important to us. There are very positive evaluations internationally. There's tons of research evidence from across the globe saying that this actually works. So that was really important to us. And it's the only programme of its type that's got the endorsement of the World Health Organization. That's a pretty high standard to get to. So that was a big part in our thinking. And also the US National Registry of Evidence-Based Programmes and Practices have also listed. And it was referred to earlier on this morning, I suppose maybe joining up the dots from other NCSE research conferences, that the Cooper report, Cooper and Jacobs report, which was commissioned by the NCSE, also recommended and stated that the programme combines the best qualities of a therapeutic programme with a general life skills intervention that can be incorporated into the regular curriculum for all students. This programme has been highlighted back as far as 2011 from in an Irish context as well as an international context. So Friends for Life, what is it? To try and give you a brief overview in as quick a way as possible, it helps children to cope with feelings of fear, worry and sadness by building emotional resilience and self-esteem. It teaches children cognitive, behavioural and emotional skills in a simple, well-structured format. And I've underlined the word teaches there because this is not therapy. We're not asking teachers to do therapy. We're asking teachers to teach children skills that they can apply in their daily lives to deal with the stresses and strains and anxieties that we all experience and which are normal. Again, it promotes self-expression and it fits well into the normal SPHE curriculum. And we're also trying, by delivering these kind of programs universally in whole class contexts, we're aiming to reduce the incidence of psychological disorders, emotional distress and impairment on social functioning. And it's founded on two core teaching philosophies. They are the peer learning model and experiential learning. And the nuts and bolts really of what it involves, it's 10 sessions, and they would maybe last between in and around an hour and a half. And there are also two accompanying psychoeducational sessions for parents. So there's a key component in this involving parents. It uses a variety of approaches. There's group work, role plays, written exercises, games and interactive activities. Am I going too fast? No, okay. The word FRIENDS is an acronym that helps children to remember coping steps as follows. So F stands for remembering our feelings, trying to wonder how are we feeling. R means remembering to relax. There's a lot of specific strategies around relaxation taught to the children. And having quiet time to yourself. I can do it, I can try my best. E, exploring solutions and developing coping step plans. So a coping step plan is a very specific way to deal with maybe difficult situations that a child's been faced with. N is now reward yourself, you've done your best. And that key element of trying your best is, and because often anxious children are very, very perfectionist, they will have very, very high, unrealistic expectations of themselves, and that needs to be challenged. That belief does need to be challenged with a more healthy way of looking at that if we know that we've tried our best, well then we can kind of relax and be happy about it. D, don't forget to practice. This is a skills-based program. It's about teaching skills and helping children to practice and maintain that. And S, finally, is smile, stay calm and talk to your support network. So the support networks are very important around children identifying who it is that can support them in their lives. So why should NEP psychologists train teachers? We would be of the opinion that teachers have a unique understanding on the individual context of their schools. They often, the research would say that teachers are more effective than outsiders like me at providing social and emotional education in schools, because teachers are there on an ongoing basis, on a daily basis. You know, an outside professional like me can come in, do an intervention, but I disappear, I leave. Where the teacher is there on an ongoing basis, that these skills can be revisited, they can be practiced and followed up on. Again, as psychologists work in the educational system, we're thoroughly embedded in the system, and we feel that we're there on an ongoing basis to support teachers in delivering programs like the Friends for Life. And again, our model of service fits very well in with that. And we also need to establish, I suppose, what levels of training, support and supervision are needed to boost teacher confidence in dealing with areas like this, because oftentimes teachers say to me, oh God, I never got the training for that. That was never included in my BEd in whatever college. So it's about trying to see what can we do to support teachers on the ground in doing things like this. So the objective of our study was to further develop the evidence base for teacher delivery of the Friends for Life programme as part of the SPHE curriculum after receiving a period of training from NEP psychologists who were accredited by the founders in Australia, Pathways. So the design and methodology, there were 27 primary schools involved across the length and breadth of the country, encompassing 709 pupils. What we did was we divided half of the schools, 13 of them, into an intervention group. You can see on the left-hand side, and there was 333 pupils in that group, and there was 14 schools then in a control group, and encompassing 376 pupils, and that enabled us to do a comparison between pupils who received the intervention. So you can see on the left, the intervention schools received it during January and April 2013, where the control group just did SPHE as normal, and then the control group actually received it just at a later time, so they received it between April and June. So ethically, we can say that everybody received the programme, but just at different time points, but it helped us to compare children who received the programme with those who didn't. There was a variety of school contexts. We had urban schools, we had rural schools, we had single-sex, mixed, multi-grade class settings, so we tried to encompass in both the control group and the intervention group all the different types of primary schools that we have out there across the country. The average age was 10.83 years, and the class that we pitched this at was predominantly 5th class, but there were some 4th and 6th class children involved in the study, because in rural schools where there was multi-grade class settings, they were part of the class groups. We felt ethically we needed to do it with the whole class. So again, the parents, teachers and guardians filled out questionnaires to evaluate the programme at the 3 different time points, time 1, time 2 and time 3. The teachers attended 2 days of training delivered by psychologists from NEPS who had been accredited by Pathways, and we did insist that at least 2 teachers attended from each school, because we would feel that a team teaching approach, especially whenever you're doing this for the first time, is very, very, very important. So again, a minimum of 2 teachers attended the training from each school. And the NEP psychologists helped the teachers to co-facilitate the parent sessions, one at the beginning and one in the middle of the programme. And we were also available to the teachers on an ongoing basis over the phone, or if they needed to come out to the school to visit, sit down and debrief if any issues were arising. But I think from the working group I would get the sense that not that many issues actually arose, thankfully. So again, but we were there where it was needed and if the teachers needed support. So some results, again, there's a lot of information on that slide. Again, the first one that we're looking at principally here is anxiety. We used the Spence Children's Anxiety Scale, which is a child and a parent version. Unfortunately, there was no teacher version of this. Again, similar to other studies, girls reported significantly higher levels of total anxiety than boys. At time 1, 17% or 106 of the sample rated themselves in the elevated range. That's significantly more worries or anxieties than the norm. And by time 3, after both the intervention group and the control group, that had reduced down to 6%. So we can see quite a significant drop there in the actual numbers of pupils rating themselves in the elevated range. The hypothesis that the intervention group would have lower levels of total anxiety was supported by ratings by parents. There was a reduction on the child scales, but we didn't reach significance with a p-value of 0.06. A significance value of 0.05 would indicate significance. So we were quite close on the child form. But the reductions in total anxiety were maintained. Oftentimes you can do a pre and a post evaluation, but you don't actually find out what happens after that because maybe the difficulties just creep back. But we were very happy to find that after 3 months that the gains that the children had made were actually maintained at 3 months follow-up. We also found interesting, and it ties into some of the earlier presentations, there was a significant large effect for children in designated disadvantage or GESH schools and those attending EBD special schools. These children really responded. There was a lot bigger impact for them, and that was very interesting for us. And again, there was significant reductions in ratings of social phobia, physical injury on the child Spence anxiety scale, and in separation anxiety and social phobia on the parent anxiety scale. So a lot of positive evidence there from that. So on the Spence, there are some written, there's a space for children to provide some written concerns. Some of them were categorised in broad themes around themselves. They were afraid of animals, physical injury, social, having their friendships being feelings of social inadequacy, societal, some concerns around criminal activity, family, and that whole aspect of familial loss. So they were some of the themes that the children wrote in the open-ended question. We also noticed that the responses to the open-ended question reduced significantly. So there's a lot more responses at time 1, whereas at time 3 they were a lot less, which indicated that, again, we would hope that that's another sign that the intervention was successful in reducing anxiety. And again, we would say, we only managed the confines of doing this as applied psychologists in schools. We only could do it over 6 months, but other international research would find that the real effects of this programme only start kicking in after 6 months, after 12 months, and even up to 24 months. So again, it is a weakness in our study that we only got to do 3 months follow-up. So again, I would imagine that the true impact maybe of the programme would be found if we had been able to do maybe a 12-month follow-up, but unfortunately, we weren't able to do that. So in summary, there's a lot of evidence there to accept the hypothesis that the programme was successful in reducing feelings of anxiety amongst the children. Self-concept, again, there was a lot of really positive developments here. I'm just going to go on ahead from this slide because there's a visual here, just which might be an easier way to represent it. In your packet's black and white. But the top line there, you can see the blue line is the intervention group. So between time 1 and time 2, when they were receiving the programme, their ratings of self-concept on the Beck self-concept scale rose significantly, and you can see between time 2 and time 3, they actually continued to rise. So as they're practicing the skills, they're getting better. Again, where the intervention groups at the bottom there, between time 1 and time 2, they dipped slightly, but then you can see between time 2 and time 3, as they're receiving the programme, their self-concept scores start to actually rise as well. So just a very clear slide about the benefits of the programme. There was very positive effects around children's ratings of how they can cope with adversity. Again, really positive. And again, the things like the coping step plans were very, very important. The children mentioned that. And the last point there on that slide, they were applying it to areas such as dealing with things like anger management, to friendships and to sports. So they were applying the skills that they were learning around dealing with anxiety and stress to real parts of their lives. School connectedness, again, was rated a lot higher for the intervention group in comparison to the control group. The children reported liking school better, and their teachers noted a more positive outlook towards school, and they felt that the Friends for Life language was being incorporated throughout the school day, which is a really positive thing to highlight. Again, families also, parents reported a sense of increased family connectedness. So again, part of the programme is that there are home activities, and you're also involving parents in the parental sessions as well. So there's a high degree of parental involvement, and that's really important to mention there too. The teacher implementation of Friends for Life, overwhelmingly positive. Teachers are well placed to do this. The quantitative and qualitative data reinforces all of that, and this is in the context of other international research which backs that up. And again, the research would say that teachers often can be as good or even better than professionals coming out from outside coming into the school. And again, we would hypothesise that teachers, it was the first time that they had delivered this programme. If it was their fourth, fifth time delivering it, we would imagine that they would be even more effective. Because sometimes we did find that the teachers did stick a little bit to the workbooks, and maybe they needed to diverge from that and make it more experiential. So again, through universal delivery, the programme we would feel is non-stigmatising, and therefore it's more acceptable to parents as opposed to being targeted at specific groups. So again, it will be more helpful for children who have high levels of anxiety, but again, it's beneficial that there is something in this for every child going to a mainstream school, and indeed special schools. So the pupil voice, I'm not going to go through those slides because I haven't got time, so you can just have a little look at those yourself. They are some quotes. There's the teacher voice and the parent voice. And again, just the middle bubble there, what a parent said, a brilliant programme and needs to be brought into schools for all classes. I feel that this programme is as important, if not more important, than any of the other subjects taught. So some of the limitations, again, I've touched on it. The follow-up that we did was only 3 months. Ideally, we would have done maybe a 12-month follow-up, but that wasn't possible. We would also feel that the workbook materials, there's a lot of koalas in there because it's Australian, so I don't know what the Irish equivalent would be. Any ideas would be more than welcome. So that maybe needs to be adapted. The teachers were confined to quite a tight deadline, so a lot of the teachers reported to us that they would maybe do it over maybe a term, 2 terms, as opposed to just 10 weeks. And it's likely, again, that teachers will be more effective as they deliver the programme again and again. Future directions, we would like to look at, how does the programme actually affect attainment scores? So to do the correlation there, if you've received Friends for Life, is there a concurrent gain around your literacy and numeracy attainments? That's an area of interest. We'd also like to look at maybe delivering to children in 5th and 6th class and seeing, do they make a more successful transition to post-primary school? Because a lot of the research out there would indicate that it I suppose brings up a lot of feelings of anxiety, and even again, it's been found that the attainments in first year and secondary school dip in relation to where the children were in 6th class. So seeing, is Friends for Life a useful programme to support that transition to post-primary? And again, the other thing to look at, maybe we're thinking about, is around the social emotional literacy of teachers. Feeling maybe, if we delivered the adult resilience programme with teachers first and then they delivered the programme with children, is that better? Because you would imagine if teachers are actually given these skills first themselves, that they would be better able to apply it then whenever they're teaching the children. And then, so again, some of the implications, I'm going to round off here now in about 30 seconds. Teachers are in a unique position to intervene early. And again, this study would show that the teachers are really well placed to do this kind of stuff. And it's really within their competence, and they're really, really, it's a very, very positive outcome for the kids involved. Again, we would also feel that ongoing support is important, and we would feel, as psychologists working in the National Education Psychological Service, that we are embedded in schools and we can help teachers to ensure that the programme is delivered with fidelity. And again, I'm going to conclude now. A final word of thanks to all of the children, parents, teachers and schools who participated in the study. I wouldn't be here talking to you here today without their help, without their participation. I'm sorry it was a whirlwind tour for going really fast. If anybody wants to have a chat to me afterwards, but I'll pass on to Maureen.